So Populus indicus, the wonder remedy which will help you in all kind of cases. Maybe now, after this remedy, you will definitely, I'm totally convinced after I finish this remedy, you will say, oh, I know this person. Maybe I'm the person, Copulus. I've seen Copulus in my life, in your neighbor, everywhere. Copulus is everywhere. I start a case. Now, you know that we are living, I'm living in a society. In a society, we have people who maintain, who take care of that if there is something wrong in the society. We have few people who represent, who help for small works in the society. It was also in 94. Now what happened in 94? There came society member to my house, maybe not 94, it's more than, it's about 98, I think. Yes. And that time I started to visit outside the country to teach homeopathy to Germany. I started with Czech Republic and Germany and UK to teach homeopathy that time. So what happened that one day they were coming to my house to collect the fund to maintain the society, and my wife was always there. Now one time what happened, I opened the door and they were standing outside. Now when they saw me, they were saying, oh, after a long time we saw your face, you are always out of country or teaching here and there. You are so busy. It is our pleasure to see you. Okay, I say, okay, please come in. I offered them a tea with me because I never saw them in the society members. Now, when I just while we were, I served them tea, we were having tea. Now, what happened that one member of the society, he brought a one puff. He took the puff, and then he said, sorry, I know you are a homeopath. Uh, Maybe you mind that I'm taking puff in front of you. I said, no, no, no. I'm not a doctor now. You are my guest. It's okay. If you need puff, you can do it. It's not my problem. I said, no, no, I must tell you one thing. That you know that I'm a asthmatic patient. And I have been using this puff for many years. But I believe I love homeopathy also. Now he just to please me maybe. And he took one bottle out from his another pocket. There is another bottle of arsenic. He said, see, I am taking arsenic. One of my friend, he offered me that whenever I have attack, I take arsenic 30. Sometimes it helps, but when the attack when it becomes very severe, that time this homeopathy doesn't help me. I'm just listening the story, and then I have to go to the hospital or take the puff. That's the only thing. But I believe homeopathy. I say, oh, it's okay. I'm not offended. If you believe homeopathy, if you don't believe homeopathy, it's not my concern. Now, have a tea, nice tea, have cookies, we will meet. And then he said, Dr. Saigal, I tell you, I believe homeopathy. But you know that when the condition becomes worse, that time homeopathy fails. And then I have to go to the hospital. Okay, so I tell him one thing. I told him that next time when you have a severe attack, very severe attack, and you feel that you have to go to hospital, then you call me. That time you must call me before you go to the hospital. And then we say goodbye, and he left. Now it was I think in maybe July or August. One day after 3 months, in the winter time, it was very very cold outside, and I got a call around 11:30 p.m. and I was saying at 11:30 p.m. who called me? Usually in homeopathy we don't have such emergency that somebody will call you at night. We are homeopath. We don't have emergency cases. Rarely emergency comes. But I had many emergency cases in my life. Okay, now this man called me, and I say yes. Who is it? He say, I am this. Yes, I. What can I do for you? I'm now having a very serious attack of asthma. I remember you asked me to come. Do you want me to come in your clinic at this time, 11:30 p.m.? It was very cold outside and dark. I said, okay, come. I took the challenge. And I could hear from the phone how difficult it was. I know how heavy breathing, like that, attack, severe attack. Okay, and he knocked at my clinic. I opened the door and I saw that he's standing, very like this, very nicely. I come, and his brother was standing behind him, 1 meter away. I say, you have your brother with you. He said, yes, because he said, I will take you to the hospital. Doctor, I was, that your house and the hospital, after your house is hospital. So I thought, let me knock your door. Otherwise, I'm going to the hospital, which is just 100 meters away. I mean, not too far. I have to now. I need hospital. They give me injection. So I say, okay, come inside. And then I saw that first he tried to stand. He took the chair and he tried to stand, supporting with the support of chair. I said, what happened? How it started? He said at 6:30 p.m. in the evening. Now he came to me 11:30 p.m. At 6 p.m. he started to feel uneasy, more uneasy than usual. And that time he was in a police station. He was in a police station to help a son of a neighbor who police caught him because of some crime, little crime. So he went to the police station to help the father, and he could not. And then he had to come back after half an hour, telling the police, to the police station, police people, please don't put the case till I come back. I will come back, then we sort out the case. He came back home and he said that I could not stay in the police station more than that. And then he said, I came and took the puff again. I took the puff and took the medicine. But around 7:30 p.m., he said that things become little more worse. So I have to open the door of my door, and I sat outside with the open air. I was grasping the open air like this. And then I was sitting. Then I was going out. Then I was sitting. I called the doctor. The doctor said that you have to come to the hospital. But I did not tell my wife about my attack. My wife asked me, oh, do you want to go to the hospital? Can I take you? I said, no, 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 I can manage. But I did not tell my wife. So I asked him that why you did not tell your wife that you are nearly having such a serious attack. He said that I know that my wife will be in panic. She works whole day. And then if she has to take care of me, she become more tired. So I did not say anything to her. Now it's around 10 p.m. I saw that she's in the bed. So I told her that you lie down, you sleep, it will be okay in 1 hour. And then he got the call from the police station. Are you coming for this man to help? He told the policeman that I will come after 1 or 2 hours. Once I get better, I will come to the police station. And then he said that he was trying, and he went to the kitchen. He took some hot water just to become normal. He took some steam to become better, but nothing helped. And now I have come to you. Now what you want to do, you can give me the medicine. I gave him Copulus 30 again and asked him to sit here for 10 minutes. Now after 5 minutes, he was very restless. But after 5 minutes, he sat on the chair. And after 15 minutes, I asked him, he said, I think I don't need to go to the hospital. I'm going home. Now he went back home, not to the hospital, with Copulus 30. And now in the morning, around, in the afternoon, around 12 or something, that his wife came. And he said that, my husband sent me to you to collect more medicine. And he told one thing, my husband has to say something for you. He said that there are many homeopathy is very good. I always believe, but you need a good homeopath also with that. So only a homeopath knows which medicine to give. And you know that he was my ambassador. I mean, he was bringing so many patients to me for asthmatic cases because he was a society man. And he was surprised that, that he was also with me for, for 1 year, 2 year. He was, coming to my house. He never got such serious attack again. Meaning that how I understand the cases. I don't need to know the disease. I was only listening the circumstances, what happened, how you are managing the case. So these stories are very relevant for me to understand. I only listen the story of the patient. For example, a patient is having a fever, a child is having a fever. I want to listen only how what the child is doing, how he is managing the life. Now coming to the medicine. The Cocculus indicus is only indicated or only known for the remedy of traveling sickness or riding sickness in a car. That is the only one of the hallmark, or the people who prescribe Cocculus only for this. Most of the people, they prescribe Cocculus only vomiting or nausea while traveling or while riding in a car. Maybe I'm right. If I'm right, those who prescribe Cocculus, they know about this symptom of Cocculus indicus. Anyone? If you know that why Cocculus is given to many people, they take Cocculus with the riding sickness, the car sickness. When they travel, so they take Cocculus before, and they don't have car sickness. That is the very limited information about Cocculus. Now today, what your information you are going to get will help you in many cases. From the time of Dr. Honeyman to the present time, it's been a remedy for complaints from nursing, not in professional nurses. One thing we all know, anger. Everybody knows about the word anger. It is very common. But why we get angry? Why the anger comes? When we are not listen properly, when somebody contradict. What is the meaning of anger? The meaning of anger is to retaliate. When something is not going according to your wishes. This is the meaning of anger. Just to retaliate, not to hit somebody. Okay, this medicine, according to Honeyman, is for the people who have a nursing habit, but not for the professional nurse in the hospital. Now, what does it mean? It means that this medicine is suitable for those who care for others or think about others. That is number one. This remedy is basically for those who are not kind. It's not about kindness. It's about taking care of the people genuine. Now, Cocculus indicus is the only one remedy in the whole Materia Medica with a genuine thinking about the people, genuine support for the people, genuine care for the people when they are sick. You can only prescribe Cocculus to the sick people when you find that the person think about other than himself during the sickness. This is the first indication of Cocculus. So the rubrics which I'm going to tell now about Cocculus: anxiety for others and care about others. Now, what is the difference between anxiety and what is the care? Okay, so now I'm going to ask a very simple question from you. Anybody can answer. It is a very common sense question. For example, I'm a sick person. I'm having headache. I'm having a very serious attack of any problem. If I will take care of myself or if I take care of other person, what as a common sense makes sense? When I'm sick, shall I take care of other people or shall I take care of myself? myself. I will not, I'm not, I cannot think about others because I'm sick. I need medicine. I need to get better first. Then only I can think about other. Okay. Now here, the cocculus is the one. 98% of sickness till he is 98% sick. He has nearly only after 99 and 100. Still, he will care and have anxiety for us. He always put other people before him. Always. It is a tendency of cocculus. So when a cocculus patient gets sick, somebody from the neighbor, a friend, from a family member, if something happened to a family member, a friend, or a neighbor, and if any of them they call cocculus patient who has 70% of attack, 80% of attack, or having a severe headache of up to 80%, which is very difficult for him to tolerate. If anyone call him and say, "Can you help me? I'm in trouble," cocculus will definitely help. Till he can help, he will go, he will help them, because the one thing about cocculus is he cannot say no. Whenever you listening a patient, I say, "Doctor, the one of the problem about me is that if anyone asks me from office, from neighbor, from street, unknown person, my family member, if any one of them asks me for help, when I'm myself is very sick, I can't say no. I will try to help the person as far as possible." Now, this society man, I asked him one question before I gave cocculus, that after you go to the hospital and when you get better, where will you go first? He said, "I will go to the police station to help the man because his son is still in the police station. I'm worried about him because I will not go home. I will first go to the hospital. After I get better, then I go to the police station. Whatever time they need from me, I will give, and then I will go back." This is the one of the cocculus person can only do. Nobody else can do this tendency. So the two rubrics, anxiety and care, are too much in cocculus. Too much. Nobody else has such an anxiety and care than cocculus has. Okay. Please keep in mind these two rubrics all the time in your life. As I already told you about anxiety and care, maybe you are remembering now. If not, I just quickly repeat. In anxiety, you are only thinking about the person, but you are not physically helping the patient. For example, you see somebody in trouble, and what you feel very bad. Oh, poor man. Oh, poor person. How he is managing in the house. Oh, my friend, she is sick. Who will be cooking in the house? Who will taking care of her? Now, this is called anxiety. But you are not going, you are not helping the person. Okay? You are not doing anything. You are just having anxiety in the mind. Oh, what would happen to her? Now my friend is sick. I'm thinking about her, how she is managing her house. My brother is sick, how he is helping. My mother is sick. I always think, doing nothing. And now what is care? In care, you are doing practically help. Whenever I listen, my neighbor is sick, I start thinking about, oh, she's alone. Nobody is there to help. She's alone in the house. So what I did, I cooked food extra and I went to her house and gave her food. It was very difficult for me because I myself has a trouble. But I thought that, okay, I'm cooking food. Let me cook more food So I gave the food to her also. Now the care is, as I told you, in care you sacrifice your comfort. That is the simple meaning of care. And in anxiety, you are not doing anything, just in thinking. So that is the difference. Now, Populus is the one with other there are few remedies only, who has both anxiety and care together. He Okay, when the Populus when the Populus problem reaches to the state of 99% or 100%, now he cannot lift himself. Now he knows that he has to take care of himself. So a stage of Populus comes after 99 and 100%, when he has to think about himself. And the patient says, doctor, when a state reaches to that level, still I think about the person. Oh, the moment I get better, I will definitely go to her. I will definitely go to help. Anxiety never goes away from the Populus patient. Never. Even at the stage of 99 to 100%. Only thing is he cannot care about the other person at 99 and 100% because he's not fully fit now. He's fully sick. But up to 98%, till he can do it, he can care about. Now, for example, as a doctor, if I'm a Populus, I always, that when a doctor gets sick, I get call from many doctors to help them. So, for example, a doctor called me, sir, I'm sick. I ask the patient. I don't ask about fever. I ask the doctor, what are you doing? And the doctor says, the doctor, that after 2 hours I have to go to clinic. So I ask the doctor, when you are sick, why you want to go to the clinic? Take rest. Don't go to the clinic. No, doctor, I have to go to the clinic. Why you want to go to the clinic when you are sick? Take rest. No, doctor, my patients, they will suffer. I can suffer, but my patient, I think about that. Oh, my patient is coming from very far. Their sickness is more than me. At least I am doctor, I can help myself, but they are not doctor. Who will help them? So, doctor, I need at least medicine so that I can go and help them. Now, this is the helping tendency of Populus in all manners. That is the number one gate of Populus Indicus. Next point. Behind time in all his action. If you pinch this patient on the great toe, he wait for a minute and then say, oh, instead of doing it at once. Now, I tell you example and you can just say yes or no if you understand this point. Have you ever done, for example, somebody asked me a question. I know the answer, but I'm sick now. I know the answer, and then when somebody asked me a question, I said, oh, I knew it. Oh, but I know this question. Oh, I knew it, but I did not answer because I was sick. Or somebody tells you a joke, but you laugh after 2 days because you understand it was a joke. Oh, so it was a joke. Have you ever seen somebody or yourself, you have done this action? Oh, no. Oh, I know this. Oh, why I did not say him like this? I should have told him like this. Have you done this? Yes or no? Or have you seen this? Write quickly in the chat. It's very important to understand Populus, this point. Oh, I'm so foolish. I knew this. Oh, that was a very simple question. But doctor, you know that whenever I get sick, I'm so intelligent. But whenever I get sick, I don't know what happened. The same question which I answered everybody. But during the sickness, what happens? I know the question. But after some time, I remember, oh, I knew the answer. Oh, it was so simple. Now, what happened? This is the one of the symptom of cocklus. The cocklus has a tendency to understand the things after some time. Now, for example, there are children, or somebody who take the exam. Now, many times it happens that a student comes to us and he say, doctor, when I study at home, I know everything. But when I go to the examination center, when I take the exam, I forget everything. I know the answer, but when I read the question, I feel is it new? And when I come out of the examination room, I say, oh, I knew it. I could not perform it so well. Now, this is one of the things which happen with cocklus, that they understand the reaction very late. So if you ask it, now in the case taking, what happened? Usually after examination, yes. Now, it is very, that you learn from many things. When you are dealing with a cocklus patient, you must know that how he behaves. I learned about this from a case. If a young boy was brought to me by her mother. Okay, I took the case. After taking the case, I say, oh, he's a cocklus. I gave cocklus. Now, after 2 weeks, he came back and he said, no change. I was astonished because I was convinced that he is a cocklus patient. But he says no change. Okay. I gave cocklus next potency. He did not come to me for 1.5. After 1.5 months, his mother has to come. So she brought him again. And I asked the boy, why you did not come? He said there was no change. Okay, I took the case again and I still found that he's a cocklus. I gave him cocklus 1M. He did not come to me for 2 months. And then I took the case again because his mother was convinced that I'm a good doctor, I will find a remedy. She said, sir, I brought him again. Please find a remedy for him. He did not want to come. Okay. I took the case and I gave cocklus 10. Now, after 1 week, this boy come back. First time he said, today I came back to you on my own. I say, oh, so what you felt? He said, I want to tell you one thing. The first remedy which you gave me has worked very well. But I understood it today. After 4.5 months, he understood that the medicine which I gave him on the first time was very good. So, friend, it could happen with you also that you are giving a remedy, and cocklus has a tendency to tell the doctor that the remedy which you gave him first time has acted very well, but after 3 or 4 months. And now I ask him, why you are telling me now after 4.5 months that the medicine which I gave you first time has acted upon you? He said, I understood now. He said that my problem was I never used to get up in the morning. I was very lazy before taking the first prescription. I was very lazy. And I used to get up from the bed around 11 a.m. I never do exercises. My mother was shouting at me, you are a lazy man. You never go for a walk. You never did anything. But after your first medicine, I started walking. I started to get up at 8 a.m. and started doing exercises, but I never realized this change. But after 4.5 months, today when I woke up early, my mother said, "Oh, you woke up at 7 a.m. in the morning?" And I told my mother, "Yes, I'm getting, now every day I get up at around 8 a.m. and go for walk." So mother said, "But this is a change." He said, "Oh, I did not notice that this is a change." So after four months, and I did not change the prescription. I continued to give him Copulus. And after 4 months, Copulus 10 m helped him to realize that there is a change. Now, this is one of the tendency of a Copulus patient. That you know that what happened in the case taking. Maybe you realize now. For example, it happens with Copulus, only with Copulus. You start a case and you ask the patient, okay, tell me about your symptom. And patients start telling the symptom. Okay, doctor, I had asthma attack, I have pain, I had this, I had that. And when you are taking a case, you ask the patient, for example, how's your sleep? What are the difficulties because of pain? What are the problem with the pain? What about your appetite? Sometimes some question you ask, and the patient says, no problem. I have good sleep, I have good appetite, I can work, I can do this. Now, after 5 or 10 minutes, the patient says, please stop. I have to tell you, doctor, one thing. Can you please repeat the question? The first question, what did you ask? What was your first question? Oh, my first question was, I asked you if you are able to work properly. Oh, doctor, you know that I came to you for that problem only. When you asked me that if my appetite is okay, I did not understand your question. But now this question was still in my mind. And now I realize that actually my appetite was very bad. My appetite is very bad. And I wanted to discuss this problem with you. This is my problem, actually. So what is the word from the Copulus patient? Actually. Sometimes you have to only hear the word, not the disease. Copulus patients usually use the word, actually, doctor, I have come to you for that. After few minutes, he say you this word, actually. Actually, doctor, I tell you that this is my problem. But now I realize your question. Now, this is the main second door of Copulus indicus. And what is the rubric about this? It is written in the Materia Medica by Kent also. So the rubric is dullness, understand question only after repeating. Now, Copulus patient is usually dull. He is not so bright. So what happened with this rubric? How we apply this rubric? A Copulus patient never likes somebody to ask him question. This is the gate number 3. A patient says, doctor, you know, especially in the morning, Copulus never is fresh. Copulus, when he wakes up in the morning, Copulus is very dull, very dull. So at that time, when somebody asks him a question, for example, a wife asks a question from his husband, who is Copulus, sick, in the morning, what do you like to eat? Shall I give you some milk? Shall I give you this? Shall I give you this? He will say no. Whatever you cook, I will eat. Whatever. So the first answer of the Copulus is, whatever you say, I will eat. That is the first answer. So Copulus is not in a position to answer in the morning. That is true. So, for example, whatever you ask a question, he will pass this question. Okay. Are you going to office? No answer. Shall I cook something for you? No answer. Shall I do something for you? No answer. So Copulus has no answer for any question in the morning. That is the very difficult part. Now, what happened after 20 minutes? He asked his wife, what did you ask? That you are going to cook today potato. I think it's okay. I will eat potato. But now the wife is in anger. The wife says, I asked you this question 20 minutes before. Now I'm cooking something else. I asked you 20 minutes before, are you going to eat potato? You did not reply. Now I have cooked spinach. Now the Copulus say, okay, I will eat spinach. He will not argue. He will say, okay, whatever you cook, I will eat. So the most obedient patient is Copulus. who never fight, who never argue with anyone, very obedient. So now what happened that another point of to understand in the morning, especially. Okay, now please understand this point. Now what happened? You know that usually in the family with the friends, when you are sick, you are sitting with them, not to show your problem. Somebody makes a point, make a joke on you. Oh, you look so dull. What happened? Or somebody, for example, somebody says something. A husband says somebody something in front of his friend, in front of family member, and the cockless wife or the cockless husband get offended. Now, what is the reaction? The first reaction is that, for example, if a family member says something to a cockless patient, just in a joke, oh, you always remain sick. Oh, she never likes water. She never likes to go outside. Somebody okay, remark on a patient, cockless patient. For example, a lady says, I don't like when my husband tell in front of other that I'm always sick. I never happy. Or a husband say, doctor, usually I don't mind whatever she say. Whatever my wife says to me when I'm alone in the house, I don't react. But I don't like when she say in front of my friend, in front of, my family member. Sometime in the party, maybe unknowingly, when I say that, oh, I don't eat potato, I don't like tomato, I don't like this, I'm very sensitive to cold. Then my life, my wife, she makes a joke. Oh, I got a husband who never likes the cold water. Oh, I got the wife. She never, cook well. But the intention of the husband or the wife is not to hurt. But because the cockroach is very sensitive, they take it as offense. They feel that the wife or husband has offended them in front of other, insult. So they take it as an insult. Now, what is the reaction of the wife is she simply say to other people, to the family member, excuse me, I have a work to do. And she leave the party. How she will say, excuse me, I have to go. She will not react anything. She will simply go out of the room and just go and she will never come back. And now the husband realized the mistake. Oh, what I did. And now the husband will go to the wife. Oh, honey, oh, darling, I'm sorry. I know I should not have told. I forgot about this. I know you are sensitive. Now the wife says, I told you many times. Please listen the voice very carefully. I told you many not to say such word in front of people. You can say when we are alone. I don't mind. I know you. But don't joke in front of people. I don't like it. I feel very bad about it. Now the husband say, I'm sorry. Really, I'm sorry. I will never say it again. Now the fight finish. Now the fight finish. The wife will come back. But she will never forget this. She will never forget this, that she got offended by the husband. She always keep in mind, but never fight. So the story of, that complex patients are particularly very sensitive about this thing. For example, a child. I prescribe, few children who are suffering from urination at night in the bed, nocturnal urination. This is one of the problem in children, 8-year-old, 9-year-old. Now, what happened that in 90s, when the mother would bring their son or daughter to me with this problem, I have noticed one thing. I asked the mother, for example, a child is 9-year-old, 8-year-old. I asked the mother if the child knows why you brought him here. If the child knows this problem, the mother said, "Doctor, he knows, but you know that before coming to, he did not want to come to you. He did not want. Before coming to you, he asked me, Mummy, don't tell the doctor about my urine problem. Please don't tell me." Now, what happened when mother knows that she has to tell me this problem because she's coming only for this problem. So what happened when the mother comes? with the child, and the mother say, doctor, he has a problem with the urine. He passed the urine in the bed. Now you see the child simply gets quiet like this. And the mother say, don't feel bad. You want to get better? I have to tell the doctor. Now I see the child, they leave the clinic, they leave the room and they go to outside. They stand outside like this. And the mother has to go. The mother says, let me go outside. I have to talk with him. He felt offended because he asked me not to tell the doctor. But I have to tell you. Now she goes outside and says, son, listen, I have to tell the doctor. Otherwise, how will you get better? But mommy, you promised me you will not tell the doctor. Why you did it? I don't like it. I don't like it. So the mother says, sometimes I forget about this complaint. And I mention it in front of his grandfather, grandmother, cousin, that he has a problem with the urination at bed. And then he will not talk with me for one day. He will not eat anything. He just stay in his room very quietly. And the face, what is the face of the person of cochlear? Like this. Like, or they leave the room very quietly. Like, excuse me, I have to go. So they leave the room. This is the tendency of cochlears. So there is a rubric which I'm going to show you about cochlears. Sadness as if from insult, only cochlears. Sadness as if from insult. This patient, the reaction of the patient is when somebody says something bad about them, jokes, especially jokes, they cannot take. They feel insult. The intention of the people around him, the family member, intention is not to insult him, but he takes it as if insult, as if they have done it purposely to insult him. The people around him, they apologize. Please listen. I did not say it purposely. It just happened. No, you did it. I told you many times not to make a joke in front of children. Like for example, a wife is sick and husband come from office in the evening. He see the wife is lying in the bed and the children are around him. Oh, you see, your mother is always sick. When I left home, she was in the bed. When I came back, she was still in the bed. And now this lady feels so bad about it, so bad that she just keep silent, immediately silent. And now the husband realized his mistake. He said, but honey, it was in front of children. She said, I told you not to say anything in front of anybody, even in a joke. I don't like it. This is the condition of couples. Very, very sensitive person, very sensitive, very polite, very mild, very obedient, no argument, no fight, nothing. The best person in the world. So cochleus is very sensitive. One can easily make out from the cochleus face something has gone wrong. He easily forgive others for their mistake, even if it has caused him harm. Now, cochleus is the one who say, okay, I forgive you. But sometimes he replies, he will first try to assess the situation and circumstances under which other person had offended him. While he tries to analyze and understand the reason behind the whole situation, his anger starts getting pacified. And the end result is that he thinks that someone, somewhere, he is also responsible for the situation. Now, what happened that, when you are sick, you listen that one of your friend has said something wrong about you, or you listen somebody has done wrong to you. Now you want to say something to that person, but you are a sick person, cochleus. Now, what happened that the Cochlear cannot go outside home, or it takes time to meet that person. Maybe after 1 week, after 2 weeks, you will meet that person to amend the things, to tell him that whatever he told about you is wrong, and he should not have said other about you so badly. But it takes time. So what happened with the Cochlear is that when he heard about this, he's very sensitive, and he feels very angry. He feels angry about it, that how come how come my friend could say something like this about me. I must tell her this is not the way. I'm not like this. I'm not a bad person. Now what happened that Cochlear start thinking, okay, I will meet my friend. I will tell her that I'm not so wrong as she thinks. Maybe she's wrong idea. Okay, now she's thinking what she has to tell about herself to her friend. One day pass, second day goes away, third day goes away. She's still thinking. Now what happened on the third day? Maybe she's right. Maybe I have a problem. Now, Cochlear start to put problem on herself on the third day. On the third day, she start to see that maybe she's wrong. Maybe her friend is right. Maybe maybe I'm wrong. If she says I'm wrong, then maybe I'm wrong. On the fourth day, on the fifth day, she meet the friend. When she meet the friend, she will not complain about it. She will say, let it be. Maybe I'm wrong. Now, why to fight with her? Why to argue? Why to spoil that thing? Why to spoil the relation? Now, the friend, the last point of the day is Cochlears never like to spoil the relation. Never. Whenever he's sick, he's compromising. He tries not to spoil the relation. He yield in the mind. Why to spoil the relation with my friend? I know she said wrong about it. But now when I think maybe I'm wrong. But doctor, if I fight with her now, I will spoil the relation. What I gain? Nothing. And doctor, I know that, my friend has said something wrong about me. I can say about him something wrong, but I don't want to hurt him. I don't want to hurt him. I don't want to insult him. I know it's bad. So always Cochlear put the situation on his way. Maybe I'm wrong. Maybe I'm wrong. Now, for example, you don't prescribe Cochlear to a Cochlear patient, and you are treating this Cochlear patient for last 3 months with no result, and still he's coming to you, and you feel very bad that last 3 months you are giving him medicine but no change. And now you are taking a case, when you are taking case again and again, asking question. Now the Cochlear patient, what he tells you, doctor, I know you are working very hard. I have no problem. I know that you are doing your best. Maybe the problem is with me. Maybe I'm not trying to understand the situation. Maybe I eat something which I should not eat. Now the Cochlear is the one who put the blame on himself, but he never blame on the doctor. He's a very kind person. He always say, doctor, maybe, sometimes I try to understand why medicine is not helping. So doctor, sometimes I think that maybe medicine is not working me because of wrong food. Maybe I'm not taking the medicine properly. But I know, doctor, you are doing your best. I have no problem. So Cochlear patient never show any anger to the doctor. Never, ever. He is very polite. Why he is polite? Cochlear patient is very polite. Why? Because of the rubric. There is a rubric which we have reverence for those around him. Reverence. This is the rubric. Reverence for those around him. Very, very big rubric for Cochlear. One of the best rubric for Cochlear. You know that Cochlear patient never ever they open their mouth in front of elders of the house. They always have a big respect. For example, a young child, we always believe that the young child are outspoken. They are, behave very badly with the elder people in the house, with the mother, with the father. They lose their temper. But Cocculus, if a Cocculus is angry on the mother, and he tell the doctor, doctor, sometimes I don't like when my mother tell me something like this. I feel very angry. Do you say something to the mother in the bad words? Do you show your anger to the mother? No, doctor. I never say anything to my mother. You know that I respect anyhow she is my mother. How can I be rude to her? But sometimes I tell the mother, mother, listen, please. I don't like such. My father, you know, I tell you a case. How I understand the patient, not by the disease. Many years ago, it was Sunday. I never see a patient on Sunday. Is always Sunday is a holiday for me. I never work. Only I teach. Apart from that, I never spend my day on clinic with patient. So one day, I think it maybe 18 years ago, a patient knocked at my house because my clinic is there. He said, Doctor, I know it's Sunday. Now you see, I don't know Cockles, but now I show you how Cockles. He knocked my door. Doctor, I know it's Sunday, but it's emergency. Can you see? This is always Cockles, the way he speaks to you. Okay? I say, but it's Sunday. I don't see it. It's closed. Sorry. You have to go back. I know, doctor, but I have a big trouble. Okay, I'm also like Cockles. So I say no. I can't say no. So I'm also Cockles. So I'm a good Cockles doctor. Okay. So it's good that I'm popular sometimes when I teach. I don't get angry on the student, even if they make mistake. I say, okay, you will learn one day. Don't worry. Okay, this is Cockler. So I say, okay, come. I open my switches on, sit there. I say, okay, let's start the case. What is the emergency that you have to come on Sunday? Now, very funny thing. He said, doctor, can I make a call to my father? I said, it's Sunday. You are spoiling my Sunday, and now you are instead of telling me your problem, you want to talk to your father in my clinic. What is this nonsense? He said, one call. I gave him my phone. Okay, call your father. I was very upset that what is this? He's sick and he's talking with the father. He can talk later on after the case. I don't know. He called his father and said something. Father, oh, I'm sorry. What I did at home, I should not have done it. Okay, his father said, when you come home, we talk about it. And he hanged up. I said, what is the problem with the father? He said, okay, doctor, I tell you what happened. At 5 p.m., my friend came to my house and I was sick. And he came to see me, just my friend. And when he came, my father got angry with my friend. Because of you, my son is sick. Whenever you come, he goes to the party with you. He eats wrong thing, and now you see he's sick because of you. My son is sick. I don't like you. Never come to my home. And my friend, he left home. I feel very bad that how could my father speak with my friend like this? What is his fault? He has no fault. I eat myself. My friend did not force me to eat. Yes, I went with him, but it's not my fault. So I told my father, this is wrong. You can't tell my friend like this. You can't say my friend like this because of you, or you throw my friend out home. This is not good. But I'm sick, so I needed medicine also. So my father told me go to doctor's side and take the medicine. So I say, why to apologize now? Your father was wrong, maybe. Maybe your father was wrong. But why you want to call from my clinic? He said that, doctor, it took me 20 minutes to come to your clinic. And the whole time I was thinking, I should not have told my father like, I shouldn't. Oh, this is not good. This is not the way to talk a father. And he was right, I think. And now when I came to your clinic, the first thing I wanted to apologize. And I want to tell him that, oh, I'm wrong. You are right. I'm wrong. So this is cockless. Now the cockless patient, whenever, even if he offends somebody, he immediately apologizes. First thing, he never want to offend elder ones, especially the elder people. He's very good with the outside, even with the elder people. He never will offend the elder people. No matter how wrong his mother and parents or elder people are. He said, doctor, I always have respect for the older people. If I see that some old people have said something to me, I remain nice with them. I know they are old. So always there's a rubric, recognize the reality and accept it. What to recognize? The relation. He's my father. I recognize he's my father. He's my mother. They are old. My father is sick now and old. So I don't argue with him. I know he's sick. My mother is, blood pressure patient. So I don't tell my problem to her. I know if I tell my problem to her, she will become more sick. So whenever she asks me, son, how are you? I say, mommy, I'm okay. Don't worry about it. I never show my problem to my mother. So there is a rubric, ask for nothing, which was for opium also. Ask for nothing. Cockless never asked for anything from his family member. He never want to disturb them. He never want to disturb the routine of the people. Now, another thing about the cockless is that he doesn't like, for example, the cockless patient says, doctor, whenever I get sick, I make a routine. I have a routine that, okay, I get up at 7, 8:30, I have to go for office. Then I have lunch. Then I come back home. Then I quietly go into my room and lie down. This is my routine because of sickness. So what is the routine? Somehow he has a problem in the morning to get up, but he get up. He has a problem to go to the office, but he goes to the office. Then he has a problem in the office to work, but he works somehow in the office. Then he comes back home and goes to his room and lie down there quietly, not to be disturbed at all. This is routine. Now, what he doesn't like, he said, doctor, you know what happened? When somebody, for example, I'm leaving home, it is very difficult for me to leave home because because of the slow timing. I'm so slow that I have to rush to the office. And now my mother, she asked me, son, without asking my routine, she say, can you bring apples when you return home? No, that irritates me. I don't like her because I have my routine. I don't like to do anything out of my routine. If somebody tell me to do something out of my routine, Cockless gets upset. Now he said, I will see. And he leave the office. Little bit angry with the mother. Mother, you say it before. You have to say me now when I'm leaving the office, bring the apple. Now you see I'm late, I'm getting late. You have to tell me, I told you many times, if you want something from me, tell me in advance. But don't tell me on the same time. I can't do it. No, this is the problem of the cockless. A cockless patient cannot do anything on the spot. He needs preparation beforehand. So he tells his family member that you have to tell me if there is a work to do. Please tell me 2 days in advance. Don't tell me on the same day. When you tell the cockless patient something to be done on the same day, he gets upset. He say, you could have told me before. I can't do it now. But now what happened? When he left the office, he felt very bad that he used bad word to the mother. Or he told the mother, can't you tell me before? He got upset like this, but he felt very bad. So while he was going to the office, then he started thinking how he can bring the apple. So then he realized that that from that while coming back from the office, he take the shortcut and buy the apple for the mother. So afterward, he will do the same thing. But what Cochlear needs, he needs time. A Cochlear patient cannot perform anything if you don't tell him in advance. For example, a Cochlear patient is sick, and a friend of Cochlear's will ask, "Can you go to the market with me today?" So the first answer is no, I cannot. But later on, the Cochlear will phone the friend. Oh, maybe you need me. Ah, maybe she need me. I should not have said no. I must have listened to her. Now she will listen. She will call the friend. What time you want me to go to the shop? I want that we should go after 2 hours. But next time, please tell me in advance. So the Cochlear will go. Definitely will do the thing, but he needs in advance. Everything should be done, told to the Cochlear in advance. Cochlear cannot do things spontaneously because he dullness. Dullness understand the question after repetition. So whenever you say something to the Cochlear, even at home, can you bring me, can you make tea for me? And the Cochlear's wife, how can I make a tea now? You know I'm sick. The first reaction. But then after 10 minutes, oh, that's not a big problem. He's only asking for tea. That's not a big issue. I can make a tea. Why not? No, this is the second reaction. So the first reaction, upset. Second reaction, adjust and do the thing. So this is a very contrast picture of Cochlear. To upset and not then realize. So what are the factors of Cochlear? Again, in the last repetition, just to tell you the sum up. Very nice person, never likes to argue, compromise. But compromise doesn't mean he's coward. He doesn't want to waste the time in argument. He always like to understand the thing first and then to react. But if you make Cochlear patient understand the things nicely, then he will understand. But if you tell the Cochlear patient things very quickly, for example, you tell the patient, Cochlear patient, take the medicine in 10 minutes interval today, and then from tomorrow, take 8 pills in the 3 times a day, like this. He said, please wait. Please wait. It's too fast for me. Please tell me again. So you say, this 3 packet, when to take? You have to take this 3 packet in 10 minutes interval. Okay. And what about this bottle? You have to take 6 pills 3 times a day. Okay, you understand? One more time now. So you say today only 3 doses. Yes. And from tomorrow the bottle. Yes. And after 2 weeks, I have to come to you. Yes. And again, last time. So these 3 pills for today only 10 minutes. So this is a Cochlear. So Cochlear patient will keep on asking you one more time, doctor. How to take the medicine? Then you understand. Maybe you are not giving Cochlear. Okay, take the medicine back, give him Cochlear. So how to understand the whole personality of a Cochlear? Maybe this will help you to understand. Maybe you have seen Cochlear like this in your clinic. Maybe you have not understood that how best you can help Cochlear with many diseases just by knowing the nature of the person. So with this, I leave you, and I hope maybe some of you understand the Cochlear after a week. Oh, that was Cochlear. Oh, only Cochlear is the one remedy, the brilliant. You can see their nature, very obedient child. So the mother likes the Cochlear sick child. She said, doctor, I want my child to get better. But from my heart, I say he never get better. Because when he gets sick, he's so nice, so obedient. Mummy, okay. Mummy, okay. Mummy, you can rest. Mummy, you will get tired. And it's so nice. I think that he remains sick whole life. I don't want him to get better because when he gets better, he's so troublesome. And when he's sick, he's so nice behaving. So sometimes, in the family, the wife says, you know, I want my husband to get better. But sometimes I think that it's better that he remains sick. Because doctor, when he's sick, he's so nice to me. He's so obedient. Whatever I cook, he eats. He never argue with me. He never fight with me. If I tell to him, I have to go to the market. Yes, you can go to the market. I go to the market. After 2 hours, I come. He never complain. But then he tell me only one thing. Ah, so you asked me that you are going to the market. Yes. But after 2 hours, he understood that she asked this question. So after she come back home, then the husband understand that the lady asked the permission to go to the market, but he did not understand immediately. So the first thing that for the calculus is, yes, you can do it. But later on he understand it was a wrong decision, or he did not understand the question in the beginning. So the thing is, they are the best, they are very reverent, and they always respect the old people. They never say any bad thing from the mouth during the sickness only. That's all. After the sickness, they are bad. They do whatever they do. But during the sickness, they recognize their limit. They recognize that now it is useless because if they fight with somebody, they invite more problem. So why to invite more problem when they are sick? It's better to not to argue. It's better to adjust. It's better to accommodate. For example, a husband says, when I ask my wife, can I have a tomato soup? Because I like tomato soup when I'm sick. Now my wife says, I don't have tomato at. Now what to do? She knows I like tomato during sick. She knows for many years. But when I get sick and I say that I need tomato soup, always the answer is, oh, we don't have tomato. Okay, tomorrow I will bring tomato. You always eat tomato soup. Why you want tomato soup every time you get sick? Now how can I explain her? This is my problem. So now I know that she will not bring the tomato, and I know that after 3 days I become sick. So I started to bring tomato on my own, and I'm keeping the tomato at home so that I don't have to ask her. This is how adjusting is possible. Every remedy has good and bad part. Please understand. Never prescribe a remedy only by good part. Except Cocculus. Cocculus has 98% good way. Only 2% he's angry when he cannot control the things. But anger is also in a witty way, in a sarcastic way. He never shouts. He never likes to shout. Only in a witty way, in a sarcastic way, he says something. Oh yes, I'm always wrong. I'm the wrong. Yes, in the marriage, I'm the wrong. Yes, I'm the wrong person. You are always right. This is the way Cocculus show the anger. Or the wife, if the wife is very angry now, she will only show 5% of the anger to the husband. Yes, it was my mistake. Always my mistake. I'm the wrong. You are always the good person. Yes? Is it okay? So now, okay, finish the matter. So I'm wrong. So she goes away. This is the way in the end, very end. But you never see this reaction because always she's eating the anger, adjusting. So sometimes the lady says, doctor, I was adjusting for 10 years with this man. 10 years. Always I was thinking I'm bad. I had the impression maybe I'm bad. Maybe I'm bad. I was always blaming myself. But now I realized the word is now I realized after 10 years that I'm right and he's wrong. This is the Cocculus problem. So the Cocculus dullness is so big dullness. After 10 years, she realized that she is right. Are you getting the point? And if she could have realized this after 10 days of the marriage, she would be the happiest person. But she could not because she is Cocculus. Now, when this lady come to me and she tell me this story, I give Cocculus. And when I give the Cocculus, then what happened? She tried to sort out the matter in a nice way. She may say to the husband, okay, I think we cannot go together. I think the best is now that we should separate. Now the husband gets surprised because he never could think after 10 years the partner will behave like this. Because husband is now like a alpha, like a leader. He knows my wife is very mild. She always yields. She never gets angry. So he's always bossy. Now after 10 years, I give Cochlear's. She's not bossy, but she tried to put her point. And now the husband say, oh, she's changed. Now husband say, okay, you are right. We are not getting separate. I adjust also now. Now the lady will think, why she did not do this after 10 days of marriage? Why she wasted 10 years? But she will not realize, maybe she will not, she will come to me and say, thank you, doctor. Your medicine has actually worked on me. My physical problem gone away. I could sleep. I could eat. Immediately, the reaction will not happen after 10 days. She finished 3 doses, 1 minute, 10 minutes. After half an hour, maximum 1 hour, the moment she sees the husband, she will say everything out. 1 hour or maximum 8 hours. She will say, next morning I got up. The first thing I told my husband, you are not going to office. Let us sit together and talk about the situation. 10 years you are torturing me. Now enough. Now what do you want? You want to stay or you want to go out? And now the husband said, what is this? The situation completely changed, but in a very nice way. So this is how homeopathic medicine helps the people, that how we understand the people, how we help with the medicine, how I understand the whole medicine, how the medicine helps the whole phenomena in the person. With physical problem, with the stress goes away, problems start to go away out.